You're having knee pain and you want to achieve a certain fitness goal and you don't know where to go, either physiotherapy or gym. Welcome to RRR Talk. Today podcast we have Tansiha with us along with her personal trainer Neha. Let's talk to Tansiha and understand how she able to continue her workout with her knee pain. Hi Tansiha.
Hi Siju. Hi Neha. Hello everyone.
Can you please tell something about yourself?
So I've been in Dubai for nearly 20 years. I'm a banker by profession. So obviously the job involves a lot of sitting on the desk, working on the computer, and a little bit of a lazy lifestyle. So there's not much activity that I can do because of my busy schedule. So that's why somehow, although I was pretty active as I was growing up in my earlier days in school and college, but ever since I started working, my profession doesn't allow me to be very, very active. Yes, a lot of people might say this is an excuse, but it is somewhat true as well. So yeah, I mean, I was trying to go to the gym, be a little bit more active since I'm here. So I've been regular sometimes for 2-3 years. Then again, there's something happens, a break comes, and then I'm not able to continue. So yeah, I mean, in my heart, I want to be as active as I can be, but the schedule and my work doesn't allow me to.
I think this is a common issue in Dubai. People cannot be consistent actually.
Yes.
We see people daily basis that people cannot be consistent.
Yeah.
So how many years you are in Dubai now?
Nearly 20 years.
Nearly 20 years?
Yes.
It's a lot.
Yeah. And I mean, it's so sad that I joined another gym, then I cancelled my membership because I couldn't keep it up. Then I started going to my community gym, but there was lack of motivation because there are no trainers. It's a smaller gym. All the equipments are not there. Then I started doing home workouts. That helped me a lot, but then again, the lack of motivation and you don't have company. But now things have changed since I joined
RRR.
RRR.
Nice. That's nice to hear that.
Yeah. How long you been in RRR?
So I've been in RRR for a little over 1 year, and it was a coincidence because our office moved to this vicinity, this building. And then we started, seeing RRR equipments being, installed, and you guys were moving at that time. So everybody was very excited that we're getting a new gym here, and the equipment, when we saw it, it was really good. I mean, you had all sorts of different exercise equipment, so many treadmills, and it looked really, plush and nice. So we were obviously happy about it. We were waiting that when will this gym open. So I think it took you a couple of months to set it up, and then you did launch. And I think I was one of the first few members that joined. And I mean, since then
it's very convenient. We are just right under the.
Absolutely. So I mean, because I'm in the same building, there are no excuses. So no matter if I finish my work at 4:30, 5:30, it's very easy for me that I just need to come down, change, and do my workout and go home. So it's convenient.
Perfect.
Exactly.
So there's no consistent issue, right?
Exactly. Absolutely. No, it helps me to be a little bit more regular. I can go to the gym. I mean, I can do nearly 3 to 4 days a week, which I think is very good considering my work schedule. So yeah,
So I think the people who work in medicine BD and who's having consistency issue, we are the perfect gym for that.
Of course.
So just before before you joining RRR, so how was your lifestyle? I mean,
so interestingly, in COVID times, I started being a little bit more active. I started home gymming and stuff, and then I started working out with somebody I know, a personal trainer, but I was having a lot of knee problems. So I started with knee issues, and I was not able to do a lot of lower body leg workouts because of my problem. So I went to the usual orthopedic. He referred me to a physiotherapist. I did a couple of sessions with them, got better. Again, I started working out. Again, the same thing happened, that my knee started hurting. And the problem was that whenever I would get a knee pain, I was not able to work out for 3 to 4 months.
Yeah.
So that I used to lose a lot of time in between. So even if I started becoming a little bit regular, because I would lose that time, I'll be demotivated, I'll again drop out and stop working out. So when I joined you guys, one episode like that happened, that I had a knee pain. And that's when, you referred me to the physio session where I met Dr. Isha. And I did a few sessions with her, and I mean, she was very good, and surprisingly, I had a history, but without doing any tests in terms of X-rays or anything, she was able to exactly know what's wrong with my knee, and she was able to nearly fix me in 3 to 4 sessions, which I thought was fantastic. And what really worked with the RRR setup is that I was seeing Dr. Isha for my physiotherapy session. She was talking to my trainer, who's Neha, for my workout session. So they were in close coordination, working together to see how well will I get better, and will I go back to working out like a regular gym goer. So I think that
We'll get a good program.
absolutely. So I mean, I remember that when I was finishing up my physiotherapy session, Isha and Neha actually sat together, and they chalked out a plan that what sort of slowly what sort of leg workouts will I start doing, and that's how I start working out
Got
again,
better.
and I got
So that's
better.
the advantage in RRR Fitness. I mean, you get a chance to see the physiotherapist, and you can continue the physiotherapy session. At the same time, you can continue your fitness journey too with your personal trainer.
Absolutely.
So we have other people also comes. For example, they have something related to shoulder or knee. They can continue the training and physiotherapy session for the knee. At the same time, maybe they can continue the upper body workout with the trainer. So our physiotherapist and our personal trainer, they integrate each other. So they share the knowledge each other, and they make sure that physiotherapists make sure that you are following the protocols and work out as per their guidance. So that's really makes sense. That's the reason we came up with a new idea.
I think this one-stop shop is a new concept. So far, I've seen that there are physiotherapy clinics who are working with doctors, and then there are gyms who are working on their own, but they don't talk to each other.
Yeah.
So this one-stop shop is a good concept, that you have a physiotherapist who's in-house, who knows what they're doing, and they're working in close consultation with the trainers to tell them what they need to do and take it forward. Because one person cannot be doing physiotherapy for the rest of their life, right?
Sure.
So you would want them to get better and to start their normal life again. So I think this one-stop shop concept is amazing.
See that's the thing. Like most of the time, when you have an issue, you go to physiotherapy center, and they can't trust the gym. So they can't trust the gym trainer. Okay, let's say I'm working on the knee, and what will happen tomorrow? The main reason we open here, especially in Dubai Community City, as one-stop shop, is see, let's say for example, if you have any issues right now and you need to continue the training with the Neha, and most of the time in any other gym, trainer doesn't want you to go and do your physiotherapy session outside, because trainer will lose the client.
Yes.
Right? And they will tell you, okay, I can fix the problem, and they will start fixing by strengthening. They will try their level best to strengthen your knee and all. But pain management is not in the personal trainer's hand.
Absolutely.
They should not deal with that. That's my opinion. So, but most of the trainers, they don't allow clients to go and do physiotherapy session outside, because they know that it will affect their number of the sessions, right? At the same time, physiotherapists,
They don't want to go to the trainer.
Yeah, to either. So it's somewhere else, somewhere where you get, as a patient, you get affected, right?
No, that's true.
So this is the main thing make us separate. So we have physiotherapy center working in the same company, and I think we are the only one company have a physiotherapy center working a clinic in the gym. So it makes us unique. So you can go to the physiotherapist, they will treat you well, and they make sure that you are not losing your fitness journey along with your trainer. So they integrate each other. So I think it's one of the best thing we can provide in the society right now. So that make things unique for you.
Of course.
My question to you is like, so when you came to RRR in the beginning, so what was the difference you understood? Like, what was the difference you felt compared to other gyms? You said that you have a trainer before, right? So how was the assessment? How was the approach?
So the assessment here, obviously, when I came here, the assessment here was a lot more technical. I found that when we did our in-body analysis and assessment, so the results that I got told me things that I never knew about myself in terms of my posture, if my left side is leaning more towards somewhere, or if my right side is more aligned or not, my hip movement, the way I move my legs, my stepping, my walking and everything. So I think that assessment was a lot more technical here. And with training with Neha for so long, I think that now the way I walk, the posture has gotten much better. And the way I walk, my balancing and all, it's gotten much better now. I'm able to walk longer on treadmill. Initially, I never used to walk on the treadmill without, at least with one hand, I would hold the rail. Now I'm able to walk properly without any support. So that was pretty good. So I think that the in-body analysis was good. The assessment was a lot more technical, and also I feel that other than, because you are focusing more on rehabilitation and resistance and recovery for people who have preconditions, I think that's what differentiates you from other gym instructors.
Yeah.
Because they are gym instructors for healthy people, for people who have no issues.
Yeah.
Whereas you guys focus more on people who have issues, and then you
we'll fix
build
them.
your plan. You fix them for sure, and you build your plan accordingly so that those issues are not recurring.
True.
Right? So that I think is one of the differentiating factor, and that is my reason why I started working out
So
with you.
that's what I said, right? So when someone comes here as a new member here, so normally what we give to them is like, whenever they take the membership, we give first the initial session to them as an assessment. So they can do a fitness assessment with our physiotherapist. So they go to the physiotherapy studio, they do a detailed assessment. So not only the in-body analysis machine, which I think every gym has, and we also has, one of the best one we have for sure. But apart from that, we do gait assessment, we do posture assessment, we check their 1RM, we check their lifestyle, PARQ. So I mean, related to fitness, you ask anything, we cover that. So based on that, we understand what is the exact requirement of this person. Then only we make a program, and our personal trainer execute the program.
Right.
So it's good that you came to Neha, and Neha is one of the best trainer I got. She can understand posture issues, she can fix your, she can work on the rehabilitation perspective, and she's an amazing judo coach too. So in case
Of course. No, initially when I started working out with him, obviously I had my knee issue at the back of my mind. And I remember that when we used to do like leg presses and leg extensions and, you know, squats and lunges and all, I used to be very scared. And I always used to tell her that if I get a knee problem tomorrow morning,
you need a refund, huh?
I need a refund. I will I will kill you.
Even when you came,
But
you were just
yes, I was very scared. But then I think slowly and gradually we improved our workout plans. We started incorporating those workouts in our leg days, even for extensions and leg press. I think the level of weights that I've done, I haven't done that in a long time, because I was always scared that I would have a knee problem. So I think the differentiation is that Neha told me the technique on how to do it, in terms of positioning your leg, positioning your feet, how to take it back, how to pull it back. I think that's very important, and normal trainers would not be able to tell you that, because they don't know how to deal with people having knee issues, for example.
So after training with Neha, how do you feel now?
I haven't felt better. My knee problem is gone completely. I able to do a lot of the workouts that I never did before. That in fact the doctor also told me that you can never do them again ever in your life, because you have this knee condition. But I think how it worked was that we were able to make a program. We were able to work on muscles around the knee area. So I mean, there was a plan that Neha had in mind, right? So we worked on that, and today, Alhamdulillah, I am able to do all the workouts.
This is the thing, you know, sometimes when you have knee issues, and most of the time, you can't blame them, doctors and physiotherapists or any other people will tell you that you can't do squats, you can't do deep leg press, or deep squats, stuff like that. And it's good. So maybe there's a reason that they are telling it.
Of course.
Can't blame that. But still, when you trust the process, when you come here, we didn't make you do a huge leg press or heavy squats or something. But first idea is to build that confidence in you.
It was a slow progression, right?
Very slow progression. Maybe you can't do 200 kg heavy squats, it's fine, but you can maybe sit on a chair and stand up, right? That you are doing daily basis.
Yes.
So we will ask you to sit on a chair and stand up, but you don't even know that that's the squats you are actually doing daily basis. So from there, we work on it. Now you are much better. So I think understand the client needs, and psychology also we need to work with that. Slowly introduce the workouts to you. That's actually matters, and it's good that you trust the process. Yeah. And Neha, she's a very tricky person. She can actually she help you in that. I'm so happy to hear that.
That's
so,
true.
You know, apart from this, like how RRR is actually helping you. I mean, I understand that it's very convenient to you. Yeah, I understood. And you can come for the regular session without any consistency issues. Now your leg is getting better. And I think one more thing, you are a daily visitor for our protein shake.
Oh yes, I think you guys, I mean, like I said, one-stop shop. Physiotherapy and workout is one aspect, but you guys are focusing on providing your clients solutions to healthy eating, which I think is very, very important. You know, they say that for weight loss, exercise is important, but what you eat is even more important.
Yeah.
So from that angle, I think you guys here provide us, you know, with all sorts of different protein shakes, which you guys make in-house as well at the barista. Then there is a vending machine as well. If somebody wants a specific brand, they can go and pick that out. Then you have a lot of healthy meal options as well for breakfast, lunch, and snacks, which I think is great.
And I think at the acai one, you're taking acai, right?
Oh yeah, that's really good.
That's my favorite.
That's like a full meal, and it's really, really nice. Yeah.
It's very thick, and we have a signature, the two protein shakes. One is espresso one, and the people who don't like the sweet taste, I think they can go with the espresso one. The other one, that's my favorite. Every single day I make sure that I take one.
It's very good.
Acai,
It's very
protein
good.
shake,
Yeah. I in fact have a lot of other colleagues have to try that also, and all of them they absolutely love it.
When you came, we did the assessment that your gait pattern like have some issue. You have some flat foot and all this stuff. So I suggested you some insoles, and after that, it was little bit more easier for you to walk and do the steps in your.
That's true actually. When I initially came, I was a little bit struggling with the flat foot condition, and what Neha suggested is that maybe I should try a kind of insole which are sort of in between custom made and off the shelf. You go to a sports shop and they make it according to what your foot condition is. I got them, and that did improve a lot, and I was able to do my 10K steps with almost no foot pain. Previously I was getting foot pain, but again I wasn't sure whether this is because of my flat feet.
This is the common issue we are actually encountered every single day. So I think, see, as you know that we are getting people from corporate companies. Most of the people who work in corporate, they wear formals and comes here, right? So their shoes is very narrow, either shoe or even socks. Some people, they buy bigger shoe, but they still wear the tight socks. So it doesn't make any sense. But anyway, when the people come, they have already a bunion toe, and they already have a weak plantar flexor muscles. They already generating flat foot, which is actually causing the pain on the lower back and neck, stuff like that. So we see people every single day with this kind of issue. So it's very easy for us to address this kind of stuff. But a small twist in that shoe can make a huge difference in your life. And on top of that, see, I know that your daily goal to achieve 10,000 steps, 15,000 steps, and you love it. And during COVID time, you lost around what? How much kg?
About 20 kilos.
20 kg. It's a completely different version was there, right? So, and you really want to continue that. But the thing that having knee pain and the plan to do 10K, it's quite difficult, right? So, what was our strategy? Can you just tell something about that?
So, I mean, one thing that Neha pointed out was obviously to get an insole, which I did. I think that helped a lot. The other thing which really helped was the daily stretching that Neha used to do after workout. I think it's more of a workout for her than it is for me. So I think that really helped, because I cannot emphasize enough the importance of a good stretch after a strength training session, because if you stretch better, your recovery is better and you're ready for the next session a lot faster.
And again, you sit for
It all matters, like your flexibility, your mobility.
Absolutely.
Like
Yeah.
everything incorporate and work.
Yeah.
So when you sit for a long time, definitely your hamstring get tight. And I see that every single time she try to stretch your hamstring.
The whole gym knows about it.
Knows that I'm stretching you. So stretching something definitely you need to do day-to-day life, which is good. And on top of that, I remember that when you came, you have a lot of muscle knots.
Oh yeah.
And your IT band, your traps. And how was the massage? How did the massage help you?
So yeah, that was another thing which was in my mind, that massage also, you have massage, and then in terms of you have the massage, and in terms of other facilities, you have the ice bath, and you have the sauna. Steam, and
sauna is always outside.
Yeah, sorry, steam, yeah. So you have the ice bath, you have the steam. So I mean that gives a full product package to anyone who's coming here. So yeah, your massages. I mean the therapists that you have, quite a lot of variety of people who know. Again, it's the same sequence of the whole thing. You have your physiotherapy, you have your gym, then you have your massage. So the therapist also works very closely with the instructor. She is able to tell her what are the areas where she needs to focus more, what are the muscles which are tighter, which needs to be released, and that in turn helps her as well, because if she is doing a good massage and she is able to release the tension, then she can work on those muscles and we can improve on our workout.
That's true.
So it's a circular thing, right? So it helps. All of you are helping each other, and
This is how we do it. I mean, see, like, let's say, she's a professional personal trainer, but she is not a professional massage therapist.
Of course.
Yeah. So the thing, most of the personal trainers, what they do towards the end of the session, they try to release the 5 minutes of traps and this. And first of all, that doesn't help. That will not help them to get a complete relaxation. But the client feels so happy. But if your muscles are tight, you need to go for massage. There is no issue with that. Just tell the client you need to go for massage. Your traps is tight, your IT band is, your lower back is tight. Get a massage done. But the thing again, what they fear, if that person go outside, maybe I lose one session in this because they're counting the sessions every single month, every single week, right? Maybe that might be the reason. But here we don't do that. Like, if she is not the professional massage therapist, she should not do it.
Right.
She should understand. She understands that you have a tightness. She will refer it to the right person. And when she realizes that you have knee pain, this is a foolish idea that she is continuing workout on the leg. So that's the reason we are sending you to the right person. We have a proper certified doctor on the board. So she will train you. At the same time, she can train on the upper body. The tightness and everything can take care by our massage therapist. Food, everything can take care by our barista and cafe. So that's a perfect thing. So my suggestion is, like, to all the personal trainers, if you don't know how to manage the pain, if you are not the right person, please don't do it, because maybe you don't know what is the exact reason. If someone complains that they have knee pain, how do you know what is the reason behind it? Yeah. So maybe trainer will come and tell you, oh, maybe because of the yesterday workout, or maybe some sprain is there, put some ice. They don't even know, right? That's not their profession, so they should not interfere with such things. So that was the main reason, I think, they help you a lot. So you went to the right professional person for right thing.
Right.
Yeah. So I think that makes us different. Yeah. So let me ask you one question. Yeah. Just give me a honest feedback. So you said that you were training with other trainer before, and you mentioned you had any issues, and he was not able to find the right solution for you, and you were having issues, right? And how was Neha compared to that trainer?
Neha, how much did you pay him to ask that question? Honest answer, I think Neha was able to plan a program which fitted my condition. And we were, what really interested me was the fact that we are able to progress. I wasn't doing the same thing again and again, and I wasn't landing in the same issue again and again, which, I mean, I keep talking about my knee issue, but that was a big part of my life which was holding me back from doing proper workouts. So I think Neha was able to understand that issue and was able to build my program around that. And with her, I think a very important role was also played by Dr. Isha in terms of giving the physiotherapy sessions and fixing the problem for me. An interesting fact is that, I mean, I haven't done a lot of physiotherapy sessions. So when I started doing with her, I think first session was okay, second was a little better. By third session, we were getting a little bit more better. Then in fourth session, she suggested me to do dry needling. And I was really scared because I've seen on Instagram, how it works and all. And it looks very scary for somebody who has never done it before. But I didn't feel it. She did, I think she 5 or 6 needles around my knee area. And I didn't feel it at all. There was no numbing, no nothing. And she's so good with her hand that she did that. And after she removed those needles, I actually felt that there's around 70 to 80% improvement in my knee pain.
Oh.
So, I mean, for somebody who's never done it before, I was quite surprised that, okay, this thing actually works, because I always used to think that it's just drama that's happening. But Yeah, it actually works. So I think from her to her, because they understood the problem, they were able to plan their program, their progress around that. And we are sitting here talking about it today with I have absolutely no knee pain and everything is okay.
That's good. So a person like you who's having tight body, sitting for a long time, and not having proper consistency,
Thank you,
and
Siju.
having knee pain, I think RRR is the best place, right?
RR is the best place, and for other people also who have some sort of a pre-existing condition, a lot of people have shoulder issues, neck issues, back pains, this, that. I always tell them, even at my workplace, there are so many offices around. It's a very centrally located gym area for somebody who wants to access it. It's close to the airport, and there is no other proper gym who has all these facilities under one roof around this area. So I mean, I always tell people that if you have something, just go and see them once. There is no harm in going and consulting people just to find out what's the plan,
Yeah.
what can be done about it. I mean, there's no one is charging you to talk to
Yeah.
people, right? So just go and see them, see what they have to say. If you like it, try it out. Maybe it'll work.
That's what I always tell people. Like if somebody asks for like about personal training, how much it is cost, I said just come and try one session. Don't pay for the session in advance. Okay, just come and try one session because I'm so sure about the quality of personal training we provide here. See, there are a lot of other quality trainers out there. I'm not saying no to that. There are a lot of people out there, but still, our personal training, I can say that it's one of the best quality service we are providing in UAE. When people come to us with an issue, we address it properly and we understand their issues, what is the reason behind it, and we treat them properly. And so, for example, you have knee pain and you come here and she did a proper assessment for you, right? And after the assessment, I personally make sure that you are achieving results properly. I reach out to you every single time. I do the follow-up, and we have an application where we can understand how much you progress and about their workout program. So they don't just come to you every day. Okay, let's do chest today. We can do back today. Tomorrow we'll do leg. What was the workout yesterday? So they don't do that. So they have a proper program to follow, and it's been updated, and it is updating every single day based on that. Actually, their career growth, their salary, commission, everything based on that too. So it's one of the big things we are doing it, and I would say that our personal trainers, they are really passionate in terms of their and seriously.
You read my mind, because I was just going to say the same thing, that when I'm working out with you guys and I'm at the gym and when I'm interacting with people, it feels that you guys are not running a business. You guys are running a passion. So you guys want to make people feel better. You guys want to make people improve their, activity level and be healthy and all that. So it's not like a business it's not all about the money. It's about making a difference in somebody's life,
Yeah.
which I think is very, very important.
Money will always come. Yeah, money will come. The first thing, see, again, like we discussed today, we are not really looking for a lot of people to come and build their muscles here, become a lot of bodybuilders out. We are not trying to produce a lot of bodybuilders from our gym. We are looking for people who's having issues like knee pain, back pain, neck pain, or any other issues. Maybe you are going for any surgery, or you just done with the surgery. So this is the right place for you to come, because the thing is, like, here, when you come here, we don't just give you any workout program like a general workout program. We take you here, we understand your issues, we listen to you, we go through your medical reports, and we send you to the right professional guys. So if you need a physiotherapist assistant, we have it. If you need a dietitian, we have it here. If you need a massage therapist, we have it here. If you need a personal trainer, we have it here. So if you need anything related to that, we send you the right professional person, and they will understand, they will sit with you, they assess your issue. Based on that, what treatment you required, we give that. So I think it's not, if somebody is looking for money, then we have a lot of other way to do it. So, but we started with a passion. So, and I make sure that my trainers are improving every single day in terms of knowledge. So every Saturday we have classes. I think you see that, right? Just after your session, you see that every day. Every Saturday we have classes and all. That's the reason I can tell you that our personal training is one of the best personal training. That's the main reason you are getting better every single day.
Of course,
Yeah.
yes,
Service that you can get.
absolutely.
How RRR changed your life so far?
So definitely made me more active. I'm able to be regular at the gym. It's convenient, like I said, no excuses. It's close to work, so I can make it to the gym like 3-4 days in a week. So that's very good. My knee pain management is much better. I think I'm able to work out in a better way. I'm able to learn from the trainers as well. So, I mean, even if they're not around, like the 3 to 4 days that I'm working with you, and other days that I'm working on my own, I'm able to do some workout on my own as well. Whereas previously, a lot of people, they don't know what is traps, what is this. Now I even know what a tibialis is, muscle is, and IT band is, and all that. So you've taught me all of that. So yeah, that has gotten better. And one important thing which I also wanted to mention here is that there is elder people classes happening. I think you have a technical term for that.
Geriatric
Exactly.
class.
So that those things are happening here as well, the classes. So I'm looking forward to getting my parents to attend those classes, because I think it's very important at their age to be physically active and as fit as possible. So I'm looking forward to that. So I mean, if they like it, then who knows, maybe RRR will become a family for us.
Part of the family, yeah?
Part of the family for us.
Good. We wish that. We like that. So when you're talking about, she was teaching you this stuff, right? And I also have a lot of clients, when they come here, they have zero idea about where is lat, where is pec. So see, people like, why should I know these things? Why would I know this name? Like, because I have you as a trainer, right? But the important thing, see, sometimes you are not able to come to gym. You might be traveling.
Yeah.
You should know what is your weight you should choose and how to do workout properly. So when you go to a hotel gym, or when you are doing workout at home with the band or something, you know how to do it. So this is the reason when someone comes here and start taking personal training, we educate them. Every single session we tell them that you should not do squats like this, because this will happen to you. So you learn with us. So, and day by day when you are learning, you are able to do your own workout. So some personal trainers, they don't want to teach their clients, because they think that once you learn, then you don't continue the training. See, for us, it's not about that. We want you to learn. So, and we also learn every day, right? And that's what we do it. So it was pleasure you having with us. So it was nice you are sharing your experience, RRR experience, how RRR actually helping you. Tansika, thank you for sharing all your experience with us, especially with Neha, how you learn things, how's everything going for, how RRR is contributing in your personal and family life. I'm so happy to hear that. So one thing I want to tell people who are having issues and sitting at home, maybe you might be having knee pain, maybe you have a tight muscles, maybe you are working in a corporate area, you are struggling to find a fitness journey. So I would suggest what she's doing now. She's coming to 3 to 4 times in a gym and doing regular workout. You're stretching, right? You're doing cardio. Your knee pain is not struggling you, giving you any issues anymore.
Absolutely. Yeah.
Yeah, you can do cardio, you can do strengthening exercise, you can have proper food, massage, everything is taken care. So I would suggest the people who are sitting at home with this kind of issue, RR is one of the best option. I would personally suggest for you to come and try. Or you can come and just give a trial session. Come here, we can give a trial session. You'll understand why we are so different. And again, once again, thank you for coming and sharing your experience.
Thank you for having me over.
Best of luck for your future endeavors.
Thank you.